Hello everyone, welcome to my channel Ravi Static Physio. So in the series of pharmacology, we are moving further and take a new topic which is adrenergic drugs and what is their action in our body. So it is very important topic for pharmacology and came for 5 marks question in your university examination. So how you can write that or answer that question. So what is the adrenergic drug? So it stimulates the adrenergic receptors and gives sympathetic action of epinephrine, non-epinephrine. They work on alpha 1, alpha 2, beta 1, beta 2 receptors. It means they are sympathetic or parasympathetic mimetic kind of action showing in the body if you are taking adrenergic drug. So like pupil dilation, pupil constriction, increase GI motility, decrease GI motility, sweating, increase or decrease sweating. Whenever we have like different kind of purposes, we are activate or taking medicine, so it will be activate or deactivate whenever we are need or depends on the patient. So classification, like direct acting adrenergic agent, it means it will be direct bind to the neurotransmitter or act on the targeted organ and like so the action of epinephrine or non-epinephrine. It means it will be effect if increase GI motility, increase sweating, dilation of the pupil, and fear and flight movement also occur in our body. Indirect acting adrenergic agent, like there is one medicine like amphetamine that will be not directly bind to the neurotransmitter, but it show the action of the parasympathetic or sympathetic into the body, but indirectly way without binding to the neurotransmitter, it will be show the action. Next is to be mixed acting adrenergic agent like ephedrine. There is medicine. It will be sometimes so the sympathetic or parasympathetic depends on the person to person. So the mixed kind of acting adrenergic into the body. Location of adrenergic receptors. It means where we have to bind after taking the medicine, different kind of medicine, the which kind of receptors are have to present to bind the adrenergic drugs. So first is to be alpha 1. So alpha 1 is to be present in smooth muscle, and the smooth muscle are present in our like different kind of organs like heart, bladder, spleen, uterus, and eye. So if patient is taking adrenergic drug, either direct or indirect or mixed, so the alpha 1 is to be present in smooth muscle. So increase or decrease in heart contractility, increase or decrease in bowel and bladder movement, increase the spleen activity or decrease spleen activity like renal effect, decrease the uterus like swelling or like not swelling, decrease uterus like passes the eliminating the waste material into the body, increase and decrease the dilation and constriction of the eyes. Next is to be alpha 2 receptors is present into the pancreas. So if we are taking adrenergic drug like metformin, it will be decreased, not metformin, there is one drug like ephedrine, so it will be decrease the insulin level in our body. Next is to be beta 1. Beta 1 makes sure, remember, keep in your mind, it is always present in our cardiac muscle, which is heart. So if patient is taking the ephedrine or like amphetamine kind of drug, so it will be increase the heart rate of the cardiac muscle. Next is to be beta 2, smooth muscle. So it will be like increase or decrease the heart activity like bronchi, like bronchodilation or bronchoconstriction. It will depends upon the condition. Uterus, like uterus activity or like gastrointestinal activity into the body. Next is to be detailed study in our classification. Direct acting adrenergic agent. These are drugs which directly bind to the adrenergic receptors and activate them to give their action. Like the direct acting adrenergic agent is to be a drug which is epinephrine or non-epinephrine kind of. So if they are bind to cardiovascular system, so it stimulate the alpha 1 receptors and increase the contraction of heart and like cardiac output of the blood. And if the direct acting adrenergic drug are bind to the respiratory system, it stimulate the beta 2 receptors and dilate the bronchi like bronchodilation, and the smooth muscle action is to be shown on that. Next is to be if direct acting adrenergic agent is to be bind to pancreas, so it will bind alpha 2 receptors via neurotransmitter to pancreas, decrease the release of insulin, so give the hyperglycemic effect in our body if person is taking like that. When we are which kind of patient like taken to the direct or indirect or like mixed kind of adrenergic drugs, So it's an indication. It binds to the alpha 1 receptors and cause vasoconstriction, and epinephrine it used to control bleeding, to slow the absorption of local anesthetics, to increase blood pressures, and epinephrine is used to asthmatic patient because of promote the bronchodilation. So, if patient is have vasoconstriction and bronchoconstriction, and if the blood pressure is to be low, so the direct acting adrenergic drugs and indirect acting adrenergic drugs are medicine taken by the patient to it will be increase the vasoconstriction, or like increase the blood pressure, or also the control the bleeding, or also vasodilation also occur in the patient body. Next is to be contraindication, but kind of when the patient not taking the medicine of direct acting adrenergic drug. First is to be alpha 1 receptor agonist is contraindicated and hypertension patient. So if patient have to be hypertension, so it will be not taken that medicine which is adrenergic drug. Alpha 2 receptor agonist is contraindicated of low blood pressure patient. Why? Because alpha 2 receptors are present in our pancreas. So if patient is taking the adrenergic drug, so it will be decrease the insulin level and person is to go to be type 2 diabetic. So it is contraindicated, not taken by the patient. And what is the doses for the asthma patient? So in acute asthma patient, 0.01 milliliter, and the cardiac arrest 0.1 milliliter for the patient. So make sure that is the uh, doses of the direct anti-acting adrenergic drugs. So next is to be indirect acting adrenergic agent is to be it stimulate the release of stored neurotransmitter from adrenergic nerve terminals. The main neurotransmitter involves here the noradrenaline, like amphetamine. So there is a drug amphetamine. It released if patient is taking the amphetamine, so it directly bind to the neurotransmitter, and it indirectly way to activate the nerve terminals and send the signal to neurotransmitter to one neuron to other neuron for activating the signals into the different kind of body for like different kind of pharmacological action. So there is one drug amphetamine. So what is their action shown in our body? So let's discuss. In cardiovascular system, it systolic and diastolic BP is increased. It means if patient is taking amphetamine medicine, so it's their systolic and diastolic is 120 by 80 is to be increased, and also the blood pressure is ultimately increased. Smooth muscle is to be relaxed, which is different kind of organ like liver and kidneys to be relaxed. And what is the doses of the indirect acting adrenergic drug, which is amphetamine? So it's to be 5 to 10 mg tablet in the morning, not in the after the lunch or in the dinner, into the morning before the breakfast. Next is to be mixed acting adrenergic agent. So these are the drugs which act directly or indirectly on both alpha and beta adrenergic receptors. Like epinephrine, there is one medicine. If patient is taking this medicine, so it will be direct or indirect action showing in our body. So what the pharmacological action in our body? So things just like direct acting adrenergic drugs, or things like that, the indirect acting adrenergic drugs showing in the body. So like that it also happen in our mixed acting adrenergic agent drugs. Like doses, ephedrine hydrochloride tablets 30 mg is to be administered in dose of 15 to 30 mg TDS. Make sure not more than that medicine, and if there is any severity, please contact the doctor. So that is the adrenergic drug. Thank you.